Alendronate Sodium Tablet is a medication used to prevent and treat osteoporosis, a condition that causes bones to become thinner and more prone to breaking. This medication works by slowing down the loss of bone, helping to maintain strong bones and reducing the risk of fractures. It is commonly used in adults, especially those who are at a higher risk of developing osteoporosis, such as postmenopausal women or those who have been taking corticosteroid medications for a long time. The recommended daily dosage and optimal timing for taking this medication may vary, so it's important to consult with your healthcare provider. Before you start taking alendronate, make sure to read the medication guide provided by your pharmacist. It's important to follow the instructions closely in order to maximize the absorption of the drug and reduce the risk of injury to your esophagus. If you have any questions, be sure to ask your doctor or pharmacist. Take this medication by mouth once a day, in the morning before consuming any food, drink, or other medications. Be sure to take it with a full glass of water and swallow the tablet whole. Do not chew or suck on it. After taking the medication, remain upright, sitting, standing, or walking, for at least 30 minutes, and do not lie down until after your first meal of the day. It's important to take alendronate on an empty stomach, so wait at least 30 minutes, preferably 1 to 2 hours, before eating or drinking anything other than plain water. Avoid taking this medication at bedtime or before rising for the day, as it may not be absorbed properly and could lead to side effects. It's important to note that calcium or iron supplements, vitamins, antacids, coffee, tea, soda, mineral water, calcium-enriched juices, and food can decrease the absorption of alendronate. Be sure to wait at least 30 minutes, preferably 1 to 2 hours, after taking alendronate before consuming any of these. To get the most benefit from this medication, take it regularly at the same time each morning. Talk to your doctor about the risks and benefits of long-term use of alendronate. Some common side effects of alendronate sodium tablets for osteoporosis may include stomach pain, constipation, diarrhea, gas, or nausea. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience any serious side effects such as jaw or ear pain, increased or severe bone, joint, or muscle pain, new or unusual hip, thigh, or groin pain, swelling of joints, hands, ankles, or feet, black or tarry stools, or vomit that looks like coffee grounds. In rare cases, this medication may cause serious irritation and ulcers of the esophagus. If you experience new or worsening heartburn, chest pain, or difficulty when swallowing, stop taking alendronate and consult your doctor or pharmacist immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking alendronate, it's important to talk to your doctor about any allergies you may have, as well as any medical history you have, including any issues with your esophagus, trouble swallowing, low calcium levels, kidney problems, or stomach/intestinal disorders. It's also important to have your mouth checked by your doctor before starting this medication, as some people may experience serious jawbone problems. Make sure to inform your dentist that you are taking this medication before any dental work, and have regular dental exams to prevent jawbone problems. If you need to have surgery, especially dental procedures, make sure to inform your doctor and dentist about this medication, as they may advise you to stop taking alendronate before the surgery. This medication is not recommended for use in children, as studies have shown severe side effects in children who took this drug. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using alendronate. It's also important to consult your doctor before breastfeeding while using this medication. When taking alendronate sodium tablets for osteoporosis, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If you suspect an overdose and the person shows severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. For Canadian residents, reach out to a provincial poison control center. Symptoms of an overdose may include severe stomach pain, painful heartburn, chest pain, muscle weakness or cramps, and changes in mental or mood. Remember not to share this medication with others. It's important to make some lifestyle changes to promote healthy bones, such as increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating well-balanced meals with enough calcium and vitamin D. You might also need to take calcium and vitamin D supplements. Be sure to consult your doctor for specific advice. While you are taking this medication, it's important to have lab and/or medical tests done, such as X-rays, height measurement, and checking blood mineral levels. Make sure to keep all medical and lab appointments, and consult your doctor for more details. If you happen to forget to take a dose of alendronate sodium tablet, just skip the missed dose and take your next dose at the regular time the next day. It's important not to take a double dose to make up for the missed one. Remember to always follow the recommended dosage schedule for this medication. It's usually taken once a week, so try to find a convenient day and time to take it consistently. It's important to store alendronate sodium tablet osteoporosis agents at room temperature and away from light and moisture. Be sure to keep it out of reach of children and pets, and do not store it in the bathroom. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult your pharmacist or local waste disposal company on the proper way to discard it when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.